Thank you very much. It's so good to see all of you looking bright this cold morning. We're so glad to welcome you to the 8th edition of the Africa Health Business Symposium. I would like to recognize a few guests that are with us this morning. I'd like to recognize the presence of Dr. Nikes Ndembi, who's a senior advisor in the Director General's office at the Africa CDC. Karibu sana, Dr. Nikes Ndembi. I'd like to recognize the presence of Honorable Anifa Bangirana, who's a Minister of State for Health in Uganda. Welcome to AHB Symposium. Honorable Cicely Kariuki, who's a former Minister for Health in Kenya. Welcome. We are also honored to have Dr. Jelita Chinyonga from Ministry of Health, Zambia. We also have Ms. Janet Biaruhanga from Auda NEPAD, who will be representing the Auda NEPAD CEO today. Janet? Here's Janet. And so we're delighted to host you today, but over to my co-MC for National Anthem.
Yes, please can I request that we all stand for the South African National Anthem.
I love it. It's always so beautiful. I would like to recognize our event partners, our sponsors. Thank you very much for partnering with AHB Symposium. United States Pharmacopoeia, are you in the room? Just wave. Thank you very much. We have Roche. Let's give them a hand. We have MSD. We have Sanofi, Lecturio, Broadreach Group, Farm Access Foundation, thank you very much, GE Healthcare, and B Medical Systems.
And we'd like to thank our strategic partners, first at the Africa CDC, Access Health, Moana Events, Africa.com, the German Health Alliance, ECH Alliance, ASLM, the USA Health Alliance, SALDA, KZN DHC, PRA Consultancy, African Global Health, Global Health Strategies, International Health Insurance Forum, and the Consilient Group. Thank you all. I guess without further ado, I guess it's time for me to introduce our moderator. I guess if you're here and you don't know who I'm about to introduce, I'm not sure whether you really should be here. So I guess that's Amit Thacker. So just to read his profile briefly, and I think what's interesting about reading Amit's profile is that, it's quite often that you read profiles and you're not really sure if the stuff is true. But I mean, from what I've seen, a lot of this stuff, I think we can all agree is definitely true. Amit is a visionary entrepreneur and an industry captain. He has been a groundbreaking pioneer in the integration of the private sector within the healthcare system in Africa. Dr. Thacker actively supports governments, corporates, health organizations, and development partners to foster effective public-private partnership initiatives towards improved health outcomes. He's the executive chairman of Africa Health Business, a health consultancy, advisory, and investment firm that aims to improve access to quality, affordable healthcare in Africa. He is also the president of the Africa Healthcare Federation, chairperson of the Kenya Health Professionals Oversight Authority, and the former chairman of the Kenya Health Federation. He has served as the director of Lumira DX, Seven Seas Technology, Amare Flying Doctors, ActionAid, East African Health Platform, and East Africa Business Council. As an active member of several institutions, including International Business Group, YPO Gold, the Nairobi chapter, Dr. Thacker also chairs the University of Nairobi Alumni Medical Chapter and serves as an advisor director to AAIC Investment PT Ltd, Coalition for Blood in Africa, United Asian Network, Gama Limited, Kenya Private Sector Alliance, and the Ministry of Health in Kenya. And I guess lastly, some of his prior exploits. Dr. Thacker founded Avenue Healthcare, a Kenya-based integrated private health service provider in 1995, which led him to receive the Best Male Entrepreneur of the Year award by Rotary International in 1999. He has served as the CEO of Amni Management Limited, Africa Medical Investments PLC, Momentum Kenya, leading him to win Best CEO Award in the Titans Global Award in Business and Professional Services category in 2017, and proudly received the Chairman's Award for Kenya Medical Association 2004. Dr. Amit, welcome.
Thank you. So joining me on this opening ceremony are going to be some four very interesting champions in the healthcare space, and joining them will also be the leadership team from Africa CDC, and going to talk a little bit about the new public health order. Before we begin the ceremony, let me also invite the dignitaries up on stage so that we can kick off the opening ceremony. First, I'd like to invite Janet Biaruhanga, who is the Senior Program Officer of Public Health, AHB NEPAD. Janet is a qualified medical doctor. She's also received a postgraduate diploma in public health research from the University of Edinburgh. As Janet walks up and takes this second seat here, she's also been very firmly rooted into the work at AHB NEPAD since 2007. And since 2017, when she joined AU Development Agency as a senior program officer, she's also in charge of coordinating and facilitating development and implementation of policies on health, medical products, ensuring the alignment with industrial development, trade, science, technology, innovation. And on this, it will lead to the advancement of the AU's Africa Health Strategy and Pharmaceutical Manufacturing Plan for Africa. So ladies and gentlemen, please join me in welcoming Janet, who's going to be with us this morning. Next, I'd also like to invite on stage another medical doctor from Zambia, Jelita Chinyonga, who has a firm belief that equity of access to healthcare should be a high priority in each country's agenda. As Jelita comes up on stage, let me tell you a little bit about what she specializes in. She specializes in public health and believes equal access to quality health services for the whole population and equity in health status. As Jelita takes the second seat, you will be pleased to know that Jelita was awarded the Paul Harris Fellow Award from the International Rotary Club for addressing social determinants of health, including empowering vulnerable communities and institutions. She's currently working as the director in the Ministry of Health and really focused on promoting greater public-private partnership. So ladies and gentlemen, please welcome Jelita Chinyonga. Next, I'd like to call someone who I worked with very closely during her leadership at the Ministry of Health in Kenya, and a real champion when it comes to public-private partnership and coordination. Cicely Kariuki, who is currently the CEO and founder of Reimagine Impact Associates Limited, is an accomplished leader. Many of you have come across her achievements during her tenure at Health, but she's also been holding fort in the Ministry of Water and also public affairs, gender. And she has got a expertise and experience in design and implementation of policies, strategies, programmatic interventions, and as I mentioned, not only in health, but also water and sanitation and agriculture sectors. She is also a leadership coach and mentor, business advisor, public speaker, and facilitator. A pragmatic and agile strategist, Cicely demonstrates unmatched knowledge in gender and youth development imperatives. Today, we are really honored and delighted that Cicely is with us today, and she'll join us for this opening ceremony. Welcome. Let me talk about Dr. Anifa. Anifa has been one of the great champions in East Africa. Anifa Kavuya is the State Minister for Health in Uganda of general duties. She has a working experience spanning from early 90s. Prior to joining elective politics, she served in various organizations like Uganda Airlines Corporation, Zambia Airlines, Luxury Tours and Travels, Uganda Revenue Authority. As the Honorable Minister of State in Uganda, she's mandated to oversee the development of hospital policies, new legislation for hospitals, and oversee the implementation of programs that will bring equity, access, and affordability throughout her country. So, ladies and gentlemen, please welcome the State Minister for Health, Anifa Kavuya. After introducing the powerful ladies who are here in front, now it's time to introduce Dr. Nikes Dembi, a senior advisor to the Africa CDC General Director General, and he's also the editor-in-chief of the Journal of Public Health in Africa. Dr. Dembi focuses on molecular virology to implement genomics and its benefits. His research interests include vaccine research, especially understanding protective immune response and genomic epidemiology with a focus on HIV diversity and resistance to antiretroviral therapy. He's actively participated in several scientific advisory panels and as an advisor to Nigeria's Federal Ministry of Health on HIV drug resistance. He's an author and a co-author of more than 100 publications in peer-reviewed journals. He is the editor-in-chief for the Africa CDC Journal of Public Health in Africa and AIDS Research and Therapy. Dr. Dembi is also an associate editor for Frontiers in Public Health and section editor for African Journal of Laboratory Medicine. He has contributed as a member of numerous international review boards and is a principal investigator and a co-investigator for the United States NHI grants. Ladies and gentlemen, please welcome Dr. Nikes Dembi to join us for the ceremony. So, first of all, you can see we're going to have an interesting hour with the dignitaries that are already up here on stage for our opening ceremony under the theme, the role of the private sector in Africa's new public health order. With this kind of diversity, I'm sure we're going to learn a lot from their experience and reflections. Let me take this opportunity to set the stage before I invite our dignitaries up to the podium. I want to first and foremost thank all of you for your time. We don't take it for granted. We know you are all very busy, occupied, and you do some great work from whichever city you've come to. We have over 16, 17 countries represented here, and many of you have traveled far and wide to be here with us, and you continue to build these strong partnerships and strong solutions to improve healthcare on the African continent. So first of all, thank you. I also want to thank all the speakers who are going to give us their insights for the 2 days, and we'll learn a lot from the speakers that we've lined up during this symposium. But let me begin by saying that during this 8-year journey that we have had in trying to improve healthcare on the continent, we have learned a lot from increasing public-private dialogue to build trust, and today we are in front of you here talking about the new public health order. 5 years ago, we were here in Johannesburg, and a lot has happened since we were last here. The pandemic has also taught us that Africa needs to manage its own resources and needs to own its own progress. It is with this in mind, and it is with the lessons we've learned from the pandemic, that we need to collaborate, to engage, and to make Africa self-sufficient in many of the solutions to improve health. The new public health order, as you see, and you'll hear more about it when Dr. Dembi speaks to you in more detail, are hinged around these 5 pillars. The 2-day event we have are going to speak to strengthening public health institutions, expanding manufacturing, vaccines, diagnostics, and therapeutics. We're also going to be talking about how do we invest in the public health workforce, but more importantly also increasing domestic investment in health, and finally action-oriented respectful partnerships. It's not just enough to have partnerships, but we've realized if it's respectful, when you have respect from all parties on the table, and it doesn't remain a talk shop, then that partnership is quite significant. In 8 years, we have seen some amazing policy shifts for the work we've done in symposiums like this. We have also seen growth of new business through the B2Bs that happen in forums like these and others. We've seen engagements between countries that help them accelerate growth. So once again, at this 8th edition, we'd like it to be an action-oriented symposium, and this is the reason we've got selected decision makers who are going to be discussing the right model of full engagement. Let me show you how the private sector has evolved and have contributed to the healthcare systems across Africa. If you look at this, you will see that you really can't change the entire continent if you leave half the team out. If you want to win in making healthcare better for the continent, you need the full team to play. This is a direct contribution of the private sector on the continent's healthcare. If you look at access to medicine, a total market of $22 billion are being spent every year on the African continent, just to use pharma. Private sector plays an incredibly strong role, not only in manufacturing of the 352 factories that we have on our continent, but also in the distribution, importation, warehouse, logistics, to ensure that we get the right treatment at the right time, at the right price. It continues to play a significant role. Some of the manufacturers are already in the room here today. When it comes to digital services and innovation, private sector again takes the forward leap. Government is a custodian and is a steward and takes charge of the architecture of health systems in every country. But look at how much the private sector contributes in strengthening health information systems across. The leadership and governance remains an important part. You will hear from some of the champions and leaders on the opening panel here of how important it is, because not only do we need more money for health, that you will hear from our Ministry of Health Zambia, who are inching towards the 15%, but we also need more health for the money that Cicely will talk to you about. When we start improving efficiencies, we can produce much more health with the same amount of money that's being allocated to our countries in Africa. We could improve in the tune of 30 to 40% more health. if we just improved the leadership and governance. It takes two to tango. Leadership and governance is not just a public sector issue. It's a public sector and a private sector issue. If there is waste and corruption, it is both public and private playing together in that space. So we must manage that, and we must curtail that, and together we can do much more. Service delivery has been a foray of the private sector in areas where there have been gaps. As you know, many, many years ago, the missionary hospitals and the faith-based hospitals played a very important role in plotting clinics and hospitals across our continent. And they did a wonderful and a fantastic job. With declining funds coming from grants and donations, commercial private sector started putting their space in areas that were not covered by the public sector. And in countries in Africa where both public and private tend to work together in harmony, we produce much better health. We have seen this even during the pandemic outbreak. We've seen this when we look at health indicators improving across Africa. And we've seen this when it comes to measuring progress. So I think it's inevitable that the dual policy of both public and private working side by side is a formula to improve healthcare in Africa. Finally, I want to talk about financing. We have to do much more. If you look at how many % of Africans actually have a private medical insurance, it's close to 4.5%. Very small group actually own a private medical insurance. And if you want to scale that up, you need a national health insurance scheme. You need a national health scheme that will cover a wider population. In South Africa, there is already a huge discussion about NHI. And many of you know the trials and tribulations and the challenges you go through. It's not different for Ghana or for Rwanda or for Kenya, for that matter. But we must do something to make sure we improve coverage for all Africans to access basic health services. We shouldn't create a financial barrier in order to access care. Health workforce, we spoke about it yesterday, that we need health workers, we need to attract, train, and retain. But we must also make sure, when we talk about retaining, they don't have qualified health workers leaving Africa to other greener pastures across the seas. That will weaken what we want to do, but we shouldn't stop training. We are way, way behind. Someone mentioned that it will take 400 years for us to achieve the ratio of qualified lab workers if we continue to train the way we are training. We're training too few, and our population is growing faster. The gap is widening. So we need to use more innovative ways to bridge that divide. Finally, as I end, before I invite our panelists to speak, the promise of this two-day event is a promise of partnership that will produce results. Results through engaging with like-minded institutions across the continent, and results that we can talk to Africa CDC too. Nikesh, our promise is that through stronger partnerships, we want to drive stronger investments and deeper investments in healthcare in Africa. We want to see the financing curve grow up. We would like to see the health workforce grow up. These are two immediate action plans that we want to derive after the 2 days. We will continue talking about vaccines and manufacturing and production. But if there is a take-home message that we want to make sure we talk about at the end of 2 days, is the how we will continuously work to make this happen. With those few remarks, ladies and gentlemen, I welcome you to the opening ceremony of Africa Health Business Symposium 8th edition. Thank you. Watch something about the new public health order. there you have it. I have a special message before I call on Janet Biaruhanga from Auda Nepa to give us her welcome remarks. And that message is from Tedros Adhanom from WHO, that he's not able to join us today, but he's sent us a video recording based on our theme, which we will play just before we invite Nikesh to give us the final keynote. So at the opening ceremony, please welcome Janet Biaruhanga from Auda Nepa to give us her welcome address.
Thank you, Dr. Amit. Allow me to read the statement because this is not my words. Distinguished guests, ladies and gentlemen, I'm delighted to address this esteemed gathering at the opening of the Symposium on the role of the private sector in Africa's new public health order. Thank you to the leadership of the Africa CDC and the Africa Health Business for the invitation and for sponsoring this event. Also, thank you to the participants that have gathered here today from across the African continent and beyond. Thank you for joining us. This reflects the collective commitment of our African nations to forge a brighter future for public health on our continent. The concept of Africa's new public health order that was initiated by the Africa CDC embodies our shared vision to address the pressing health challenges facing our people. It focuses on 5 critical issues that will shape the trajectory of public health in Africa: strengthening African institutions, expanding manufacturing capabilities, investing in the health workforce, increasing domestic investment, and fostering action-oriented partnerships. I think he already mentioned all of that. Amidst these endeavors, the African Union Development Agency has played a pivotal role in advancing Africa's public health agenda. Through our leadership in the Pharmaceutical Manufacturing Plan for Africa, we have pursued a 2-pronged framework aimed at enhancing local pharmaceutical manufacturing capabilities. Prong number 1 focuses on ensuring the availability, accessibility, and affordability of quality-assured medical products to improve public health outcomes. Prong number 2 is dedicated to supporting the creation of a viable pharmaceutical industry that is competitive, self-reliant, and that ensures a sustainable supply of medical products. Our successes have been manifold. By establishing regional health financing hubs, African Union Development Agency NEPAD has continued to coordinate partnerships that support regional economic communities to deploy innovative mechanisms to attract, increase, and sustain investments, ensuring that African nations can invest in their own health systems. Furthermore, our private sector engagement in health framework has fostered the active involvement of the private sector in driving innovation, efficiency, and sustainability in the health sector. In alignment with the pillars of Africa's new public health order, the African Union Development Agency, NEPAD, has also prioritized strengthening the community healthcare workforce and ensuring occupational health and safety, as well as strengthening cross-border health surveillance systems. Recognizing the significance of these endeavors, we have collaborated closely with the African governments, regional economic communities and stakeholders, and the African Union Commission, the Africa CDC, and numerous other partners. Our commitment to harmonizing regulation of medical products across the continent has been unwavering. Through the African Medicines Harmonization Initiative, AMRH, the African Union Development Agency, NEPAD, has laid the foundation for the establishment of the African Medicines Agency, AMA. Additionally, our continental technical committees on the various medical products regulatory functions are envisioned to further strengthen the work of this agency, ensuring the availability of safe and effective medicines for all Africans. Furthermore, we are proud to lead the way in advancing the adoption of emerging technologies to address vector-borne diseases, particularly malaria, through our Integrated Vector Management Program, the IVM. By harnessing the power of technology, we can revolutionize our approach to disease prevention and control, improving the lives of millions across the continent. I would be remiss if I did not mention the remarkable progress we have made in tackling tuberculosis in the mining sector. Through targeted projects, we have effectively addressed the unique health challenges faced by this vulnerable population. Furthermore, our partnership with PEPFAR to eliminate AIDS in Africa by 2030 is testament to the power of collaboration and shared commitment to achieving ambitious health goals. However, none of these accomplishments would have been possible or can continue to be possible without the unwavering support and collaboration of our African governments, stakeholders, the African Union Commission, Africa CDC, and our esteemed partners. It is through these, your tireless dedication and shared vision that we have been able to chart a course toward a healthier Africa for all. So as we gather here today to deliberate on the role of the private sector in Africa's new public health order, let us seize this moment to reaffirm our commitment to collaboration, innovation, and inclusive partnerships. The African Union Development Agency, NEPAD, will continue to play its role in advancing health as a development agenda. We will continue to work with you on the priority areas that were agreed during the private sector investment in health dialogue that was convened in October in 2022 as follows. Number one, supporting governments to adopt more favorable policies and legal frameworks that will facilitate private sector participation and set up required regulatory frameworks. Number two, mapping of key areas of private sector engagement to inform definition of priorities, implementation of interventions, and monitoring and evaluation. Number three, consolidating private sector federations at continental, regional, and national levels to ensure coordinated efforts by private sector in contributing to health. Number four, developing a full set of AU public-private partnerships in health document that can be adopted and implemented by the regional economic communities and all member countries. 5, setting up coordination mechanisms and operationalizing technical working groups that will drive different components of private sector engagement in health. Together, we can build a future where the private sector, governments, and civil society work hand in hand to transform public health in Africa, ensuring a prosperous and healthy continent for generations to come. I thank you and wish you successful deliberations.
Thank you, Janet. Your message was pretty clear as we'll work together in making that happen. Let me now invite Dr. Jelita Chinyonga, Ministry of Health, Zambia, to give a few remarks. Jelita, please come over. Please welcome Dr. Jelita.
Thank you very much. I think I just want to take this opportunity to thank AHB for inviting us. It is indeed an honor and privilege for me to be here. I think, let me start by saying that we are all struggling to attain the new public health order. But how many people have heard about it? I think we need to do a lot on that. So we're at Zambia, we are saying that Zambia, like most of the countries, have embarked on a transformative agenda to attain universal health coverage. And the only way we can do this is through public-private partnership. In Zambia, we have guiding principles, and one of our guiding principles is partnership. Who are we partnering with? We are partnering with the private sector, we are partnering with the community, non-profit and for-profit making organizations, which are the private clinics and all those. And when you look at what happened during the COVID pandemic in Zambia and all the other countries, there were a lot of interactions, and we really did complement ourselves together. So we're able to attain what we reached because of the works that we did. So in Zambia, the Ministry of Health is mandated to provide cost-effective quality health services as close to the family as possible. So we have partnered with the lowest level, again, when we look at the community level, and that is where the activity is. When we are asking each other, where is health produced? Health is produced at the community. And who is at the community? It's the individuals. So that we need to start with ourselves as individuals. Once we have the information and the knowledge, then we can be able to act and make sure that we have preventive medicine and all those preventive activities. So one of the issues that we are looking at Zambia is the issue of financing, especially at the community level where health is produced. Yes, we acknowledge we have two types of cadres at community level. We have the community health workers and the community health assistants. So the community health assistants are paid. They are on a civil service salary, but the community health workers are volunteers. So how long are we going to have them to volunteer? And they are the right people that are closest to the family. So we are saying that as Zambia, we've developed an incentive package to make sure that they are not volunteering, but they are given something to make sure that the work is done properly. We are looking at motivating the community health workers. How do we motivate them? The other one is how do we retain them? And even yesterday when we were discussing the issue of the laboratory services, one of the issues we've noticed is that there's a huge brain drain. Some have left, they've gone to other institutions, like others have jumped from laboratory to finance and all the other issues. So how do we motivate the workers, and do they have a career path? What is the career path? If I'm a laboratory person, I'm a community health worker, what am I staying for? What is motivating me? Yes, I'm able to do something to help the community, but what else is there that I can benefit from that? And then the other thing we're looking at is the private sector coming in to support the community level. We are doing very well at other levels, the hospitals and all the others, and we are doing something at the lower level. I think one of the issues that we can brag about was during the pandemic, for example, in Zambia, the private sector helped even at community level. We did not have enough psychosocial support, but we did have the private sector coming in to provide psychosocial counseling. They even set up call centers to make sure that people are accessing those services. And we all know how critical psychosocial counseling was during that period. So I think those are the issues that we need to look at. How is it that we involve the private sector at community level? And then maybe before I end, I'm looking at the time there. I just want to quote what the then acting director for CDC, Dr. Ahmed, said. I begin the quote. Allow me to also persuade you that this is time for a new way of doing things in the continent to achieve our health security. A vision that takes Africa from always following others to a continent that is confident in its own skin. A continent that sets its own agenda, develops its own internal capacity, establishes its own priorities, seeks its own indigenous solutions, and uses domestic resources to initiate action. That is the end of quote, and this was given by the then acting director for CDC at the Kigali International Public Health Conference. So I think with that, I think it leaves us with a lot of thoughts of how us as Africa can manage on our own internally, the private, the faith-based, and everybody. Thank you very much.
Thank you, Dr. Jelita. And I think the point was made very clear. It's all about action. Let me now take this opportunity to invite our next speaker who's going to give her remarks, Honorable Cicely Kariuki, who is the CEO Leadership Coach and the former Minister for Health. Honorable Kariuki, please, the stage is yours.
Thank you very much, Dr. Amit. Good morning, all of you. I'm privileged to be here, and it's always very good to read the CV of a former minister and say the good things. Amit forgot to tell us that I am the only minister who resigned from cabinet last year. And I resigned because I had the urge to do what my sister from Zambia spoke about, to go to the grassroots, mobilize action as a governor and a politician, and to bring what I had learned sitting in high offices at that level, because that is where action is. So Amit, on my next bio, please tell them I resigned. But I didn't succeed 100 days later of very intense campaign. My president thought it wasn't a good idea, and he wanted me to go back to cabinet, and so he recalled me. I also didn't go back to cabinet. So what I did was now to recreate the new path, which is why I am here. I am now in the private sector because I'm able to connect what happens in policy, where my sister is sitting, and what the private sector can do, and bring it all together, having been there for 10 years and now on this side. So I am doing this through just sharing my lived experience in cabinet and in policy, but also championing a few things. Again, Amit, tell them I'm also a champion of ending period poverty in Africa. But so that I can be of a little help, I've also gone back to acquire some new skill sets as a leadership coach, but also as an emotional intelligence practitioner. So I've not been asked to speak about me, but it's important that I bring that to you and to say that I am talking about or reflecting in the manner that a leadership coach would, not offering any solutions, but just helping us to reflect on issues, touching on leadership and governance, and because it is so connected with the human resource issues, to also leave us with a few reflections that then can inform a bit of the conclusions that we take out, we share on a plenary, or we take out in our own countries and be able to also make sense around it. 5 minutes is very, very short, particularly when millions of Africans continue to die despite of the investment and the progress that has been made. But I'll try and, indicate that one of the problems or the challenges that we are having, following this sorry state of our health systems, is because the majority of the people who are responsible to lead, to manage, and also to govern have little preparation to be able to succeed. They come into the space very, very well qualified in terms of the technical aspects of these three issues, but they are really not prepared. Now, Yet again, we are being told, especially by the people who've come ahead of us, that it is possible to push the envelope a little bit further to surmount the challenges that we are currently experiencing, which was really what brought the underbelly or exposed the underbelly during the COVID pandemic. We are able to surmount and go forward. If we know that leadership and governance are critical building blocks of the health system, they are also quite essential in terms of strengthening national health systems. It is therefore core and important for us, as I join Amit in agreeing that we can push the envelope. The private sector is at 20% in terms of contribution here, human resource, 30 governance. It is possible we can more than double this if we are a little bit innovative around what it is we need to do and are coherent in terms of the approach that we take. So I want to take some reflections by saying that the fact is that building the 6 building blocks, 2 of which are leadership and health information system, they cross-cut, and that is a fact that is known to all of us. Yet again, I have alluded to the fact that we have professionals who are qualified with sufficient technical skills, but are not skilled or experienced in management and leadership before being offered the managerial roles that they undertake. It is then no wonder the surge of leadership training programs that you have seen in the past attempting to address this gap. However, there is very mixed outcomes or results that are able to connect the leadership training, governance training, and actually what we get as an outcome or output. Some of the challenges that perhaps we need to reflect and think about that are being documented include institutional inefficiencies. Again, Amit, you alluded to this, and you said in some cases, in some settings, we are experiencing inefficiencies going all the way to 40%. Resources that can be turned inside to give us more health. We are also exposed to some outdated regulatory frameworks with good effort now, and what we are having here through the public health order is a very, very worth and welcome development. Poor access to facilities, but also inadequacies in embracing the PPPs. That is from not just embracing the philosophy, the conception, the practice, but also putting the PPCs into optimal use. Again, depending on the setting, there are countries like Kenya where we really don't have a problem working in partnership with the private sector as government, but in some settings, it's really the opposite. So we are failing to optimize on what looks like a ready and available resource to come in to bring more resources, to bring in more innovation, and so on. If I talk about the human resource shortages again, Amit, this unfortunately I wasn't able to join, but just to again emphasize how important it is for the private sector to be involved, because again, here is where we have innovation. And that is innovation that is both inward and outward and can be able to work with governments to drive or accelerate the outcomes that we desire. I will now pause and ask, because we cannot move forward retaining talent even after we train, given where we are at, what do we need to do with the intergenerational transition that is staring at us? How do we address the Gen Zers? How do we address the millennials? A few of them are here. I'm not sure that we have a lot of the Gen Zers. Yet again, these are the people we are going to be handing over the baton in terms of leadership and management too. They're impatient. They are not like me. They are not interested in a pension. They are asking to be listened to. They are asking to be more engaged. They are asking that we allow their innovative genius to show up. They are asking to come to workspaces in formal offices, Madam Minister, dressed in jeans. They are asking to be given what is called reverse mentorship. Who is addressing that question if we don't take it now and make it into some sense? I close by reflecting on the following. How do we then take these conversations forward? There are gaps, there are challenges, there are huge opportunities. There is demonstration that together we come out better and we can win faster. I want to propose that what the future in terms of leadership, governance, and human resource should look like is one structure that is more coherent, is holistic in terms of the approach, so that we are able to implement the 5 pillars as a system. It's going to look like it's collaborative. It's going to be one that projects equitable partnership frameworks at the micro, the macro, and also continental and regional levels. It's going to be innovative. Again, inside, outwards, for us to be able to get the health skills, the attitudes, and the competencies that we require. And if then leadership and governance is commonly regarded as a key, the glue, in fact, as I saw, the 5 pillars, leadership, governance, human resource sits at the center, is really the nexus of everything else. We could have resources, we could have institutions, we could have IT, but if the glue doesn't bring everything together, then I think it will be hard work for us. And we'll take the 400 years we are speaking about. But if we pull everything through that nexus as the anchor, I think that we are able to move a lot faster. So I see a great opportunity, ladies and gentlemen, in terms of the private sector taking its role and the baton and running. My final thought is that the burden is upon each one of us present here today, but also the ones that will be able to reach using various systems or mechanisms of communicating. And that if you are a leader, if you have been one, or are waiting to be one at any level, or if you're a genuine partner, which I believe we have genuine partners here, we are being challenged to step up, to rethink, to redesign, and to deliver the capacity that is needed for us to go beyond this VUCA era so that the future looks better for the populations that we are being called to serve. And if we are truly to address the challenges, some of which I have lighted and some which are already known by yourselves, we need to remind ourselves that the strategies that worked yesterday are not going to work today, neither will they work tomorrow. So as a team here, the private sector working with governments, we need to catalyze acquisition of new skills. We are being told these skills for the health sector are going to be innovative. They need to be multidisciplinary. The approaches also have to be enticing and exciting, especially to carry the millennials and the Gen-Zers. These methodologies and approaches will need to trigger immediate knowledge transfer to resolve our most immediate challenges, which are unknown. We need to be able to be practical in transferring this knowledge. We need to be able to convert the training models that we've seen in the past, and these will take the private sector to cause long-lasting impact on institutions, on the institutional health system. We need to be able to enhance the roles of leadership coaches, Cicely, to help the managers, to help the teams gain deeper insights by reflecting and taking on the leadership roles inside out. We need to establish different learning hubs across the continent, and I think Janet spoke to a bit of that, so that we are able to do peer learning. We need to listen to the leadership thought leaders that have come ahead of us. Those who are practicing right now, we need to listen to the researchers. They are telling us, especially the policymakers, Madam Minister, that there is sufficient demonstration that there is positive correlation between attitude shifts, skills, and implementation of learned knowledge through practice that is attributable to innovative leadership training. They are also telling us we need to ensure the capacity development that we take will not be about respective individuals. I have a PhD, but rather it will be institutions across the board so that the impact can be, again, across the systems. They are also telling us we need to develop robust and sustainable health systems, which therefore means the private sector could be the best fit in some of these aspects, and that's why I champion private sector engagement in an otherwise very, very public-heavy sector. And by the way, what can we do to tap into the wise guys who are called the emeritus? I think that's a category. If I wasn't recalled, I would be emeritus something. But I didn't like the title, so I am not emeritus. That's why I'm here. What do we do to tap into this? Some in the diaspora, some right here with hundreds of tons of either published material that if we tap into can make our journey shorter and faster. Maybe Janet, from where you sit, and my friend Nekaisi, we need to think about how do we tap onto the knowledge of the people that have gone ahead of us. Ministers across the board, experience across the social determinants of health, willing to either freely mentor or coach or just be available. How do we tap into that knowledge? I conclude by saying that, just again, in terms of time, just quoting Nelson Mandela Madiba. What he said many years ago rings so true to me today that he says, it always seems impossible until it is done. It looks like it's impossible, but it will be done because it will be done. I close by saying, I want to thank you, Amit, and your team of HB, the collaborators who are present here today, all the participants, and those who've gone ahead of us. I think we need to salute them at every point of the way. Now, as I ask you to reflect, I will be available and really looking forward to engage because I also want to learn from you. But importantly, what role will you play after this symposium? I sign off by saying yours truly, I've enjoyed the 5 minutes. Isn't sufficient, but I've enjoyed. Thank you very much.
Thank you so much. It's true, 5 minutes isn't sufficient, and that's why I'm hoping with many of our panelists, you'll be able to engage with them for the next 2 days. Thank you, Honorable Cicely, for telling us about the glue, reminding us that it's critical. And this is a good segue now to invite the State Minister for Health for General Duties of Uganda, Honorable Anifa Bangirina Kavuya, to come and address us. Please welcome Honorable Anifa.
Thank you so much. Wow. Coming to make my brief statement after Honorable Cecilia. I'll try my best. All distinguished dignitaries and VIPs invited for this symposium organized by the African Health Business and its partners, I salute you all. Protocol is hereby observed. I want first to take a small, let me make it more diplomatic, that my friend and brother, Dr. Meet, next time I come here, I want to see a picture that resembles me, a picture that is more polite, a picture that is not shrewd politically, a picture that displays me in the line of the health sector. So before I leave here, I need one. Thank you so much. I want to say I bring you warm greetings from the Republic of Uganda, from my President and the entire Ministry of Health. I have people that I've moved with at the highest positions, directors of governance and regulations, private sectors representatives, and I want to say that I am highly honored today once again to participate in this very important symposium. I have participated in the work led by African Health Organization for some time, and I'm one of the very few that have come to appreciate that we who have been in another life of circle, as my sister Honorable Cecilia said, who resigned. I am not yet about to resign. I am only thinking when I will retire from active politics. I have been at the helm of politics as a legislator since 1994 to date. I'm a member of parliament. I have been a member of parliament in the past at the Pan-African Parliament for 6 years, and I'm still going strong. So what do I bring on board? I bring on board the importance of policy and legal formulation together. And I'm an advocate of not leaving anyone behind. We in that area, it's very important that we must ensure that if we are to achieve in every angle of aspect, we must bring the political will on board. Policy formulations and legal frameworks are very important. We may have them, but they are not tailored towards the cause for the public-private health sector and everybody. We may have them on our shelves, and they are not implementable. So they would not fit into the cause that we are fighting for. So once I'm here, I listen, I learn, and with that background and experience at my other forums, I share out what we have shared here, and it will make our life easy to move together. I therefore want to thank my friend Dr. Amit Thaka, Executive Director, your partner CDC, and everyone who is doing good work towards to bringing all stakeholders together to discuss health matters, emerging issues in the health sector. This is very important, especially after the post-COVID-19. We are aware we are all living in turbulent times characterized by pandemics, epidemics, economic stagnation, as well as disruption, global chains around us, which all require very, very strong partnership, very, very strong cooperation, very strong solidarity and dialogue, and of course, equitable resource sharing, among others. And that is what all the symposiums organized by African Health Business are here intended for us to achieve. And I want us to put our hands together and thank them. Thank you. We are again gathered here in Johannesburg, as I have said, to discuss the role of the private sector in Africa's new public health order. I want to thank those who have presented before me, having brought out the importance of bringing and supporting the private public health partnership. If this private sector in Africa, we are to achieve the new public health order that we are striving to achieve together. Allow me to appreciate CDC and all partners towards all the contribution that was given to all of us, more so to my country, Uganda, during the time of the pandemic, COVID-19 and Ebola. We really thank you so much, and everybody that continued to assist us up to that. So this one brings me to the 5 strong pillars of the public health order for Africa, which is a roadmap to sustainable health outcomes and health security, as they are well speculated out. I don't need to go through them. My former presenter said what we need to do in the health sector and what it strives for us that we must ensure we succeed together. I want to assure you that as Africa, we should have a workforce that needs to address the health threats. We must include the domestic mobilization of financial resources, human capital, technical resources, and networks together. Action-oriented partnership is very important. We may think and talk about partnership, but if it is not action-oriented, then we may leave it as where it is without any focus and achievement. We therefore need to ensure that there is health workshop development. Workshop force development is not only to develop our workshop, but we must ensure that it is very strong, nurtured, and retainable for the strong public we have. Now, this brings me to the question, and to all of us. The question is, how best shall we deliver the new public health order for Africa? We need to answer that. Number 2, what do we need to do different as Africa in order to improve our health outcomes and health security, especially after the post-COVID, which exposed the weaknesses within our health systems. And that's the reason why we are here. And that takes us back to say, we need to appreciate that we cannot, and I repeat, we cannot go back to change the past, but we can take the positive aspect of COVID-19 that gave us an opportunity to rethink together. To rethink together. There is no single country or member state or any maritime organization or stakeholder would be able to achieve the new public health order alone. We need, therefore, to come together, to work together, to find solutions together. And the solutions must be tailored to our own aspects of life. We have to work together closely with the private sector and civil society. They have the same interests like us in government. So they are our driving factor. And I want to tell you that in Uganda, 40% of our healthcare system to the population is provided by the private health sector. And we are proud of you, those who are here and those who we left behind. The pharmaceutical sector and the manufacturing sector is also predominantly driven by the private sector. We therefore need to support the private sector and work with them, strengthen our health infrastructure. Our health development structure is very, very vital, and we cannot do it alone without involving the private sector, the civil society, and everybody to be brought on board. Even governments within their own financing, they cannot do it alone. Health structure development needs strong, supported private health sector. We must rethink on how to use them, cooperate with them, partner with them, and encourage them to be part of this system. We need strongly to improve on the workforce and improve availability of vaccines and medicines for our people. I don't need to elaborate much. You saw it when we had COVID-19. We waited until those who had the capacity to pass over what was left to them. And nearly the entire African country was wiped out. It's high time we thought together and work together to ensure we have means and we are capable to have our own way of manufacturing our own African medicines. We are very rich. We have all the brains here. It's only me who is trying to add my political brain to your brain, but add your own brain scientifically and we do something about having manufactured medicines on the African continent, so that whenever there is a pandemic, we are prepared. This one opened our eyes, found us unprepared, Uganda inclusive. But now we are very prepared. And that's why I want to say that in Uganda, for example, we have invested so much in surveillance to detect early pandemics, not only in management, not only in control, but detection, early detection. And you cannot do that when we have not invested in diagnostics. When we have not invested in data collection, maintaining, storage, and transfer. Technology transfer is very, very important. Sharing out, especially we who are living around the border areas with other countries. We need to work so much together. And I want to say that it is very, very important that at this time, we must put our heads together. And I really want to thank you, Dr. Mithaka, and your team to always bringing us to discuss these various emerging issues and to find solutions that are definitely from our own background and tailored towards achieving very strong health systems back in our countries, and to ensure that together, yes, we can. Allow me once again to reiterate our commitment, those who participated during the Egypt Symposium. We had made commitments. and very serious commitments. And I want to assure you that I'm not a person who just makes commitments. You know, I have that experience I have said. Our head of states, and I'm sure those who come from the AU, I had the chance to present the AU Pan-African parliamentarians at UN for 5 years. I had to participate. With due respect, my president inclusive, very strong vision president. They are very quick at signing. Signing what? Signing instruments. Yeah, that's why we cannot even implement the 15% health care in our budgets. But we all signed, all member states signed, Uganda inclusive. Now I am happy that Zambia has said you have in your budget. And I've told you I've been there. You know, budgets are controlled in some of our places by the policymakers, but the policymakers who don't have backgrounds of what we are talking about here. So they normally do not prioritize to give a share to the health sector, to the social sector. In our budget, it attracts the least budget. I know all of you, you know what is happening in your countries. You'll find the defense budget is 80%. The audit sector, 60%. The health sector, 20%. You cannot develop, you cannot have an economic acceleration of your own economic growth when the 98% of the population are all sickly, when our systems are very weak. You must strengthen our systems. You must ensure that we have strong systems. You must ensure we have good health communities. Then we shall think about having the economic wealth about it. Now, we are talking about alleviation of poverty. Thank you so much, my sister. But we must think about the health of those people you want to get out of poverty. They go together. But what comes first? We need healthy living. The good health of living of our people. Then we can bring them up. A sick mind is a sick mind. It cannot think, it cannot develop, it cannot add value to anything. So let's first work on our life living. 1 minute to go, half a minute now. I want to say sincerely, as I said, we must think as I reiterate our commitment at our last meeting in Egypt that if we are to shape and strengthen our health systems in partnership with the private sector, civil society, and everybody on board, every stakeholder, we must, and I repeat, this was in the opening remarks of Dr. Amit, strongly prioritize investment in technology transfer. It does not help us when some continent has got its technology and it keeps it there and it is not sharing it out. If you are not sharing it out and you have it in Kenya and I'm your neighbor in Uganda and I don't have it, what comes from Uganda goes to your place and you remain with your technology there. So once we share it, it helps us to benefit to how to address the issues, health issues before us. Diagnostics, of course, we need to invest for early detection. Prevention is better than cure. If we want to emphasize that we are going to have medicines and we are just giving medicines, but we are not working on prevention, there are so many diseases in our communities that we can prevent if we worked about having prevention as the first priority. Research and development, I don't need to say much. There is somebody who is going to talk about it, and he told us sometime early morning that we should prepare ourselves. Human resource and capital development and data collection is very important, as well as health financing and resource mobilization. But we cannot focus on resource mobilization when we are not strategically clear of what we want to do with that resources. We must have strategic planning. If we are to implement our public health order, strategic planning, policies that are tailored towards those that are supposed to have them, those are the bottom up, all this will lead us to achieve what we intend to achieve. I want to thank you so much for having invited me here. Next time we do it, I will do the needful that I have not done. Thank you so much, and I hope we won't march out of this room the way we have come. We have all come to share. Nobody has experience over the others. But that experience you have, we can share it out, and it benefits our places. And that's the question which said, after here, what next? To pack our bags and go, or to transfer what we have learned from here to those that need it, especially our governments, policymakers, everybody. It's high time we invest also in the private sector, ensure that they are very supported. I thank you so much. Thank you for listening.
Thank you, Madam Minister. And thank you so much for always being a true supporter of partnership, which is respected. I want you to listen to the DG of WHO, Dr. Tedros, who, as you all know, has been in the forefront of an institution that went through an extremely challenging time during the pandemic. 5.9 million people lost their lives just in that period of 2 years. And another 12 million lives were lost on what we call excess deaths. 18 million people within a short span across the globe. And WHO, together with partners, needed to work extremely fast with many private sector organizations here to produce tests, vaccines, and other solutions that could curtail the spread. Institutional rivalry in healthcare was identified as a barrier. You all know what I'm talking about. WHO managed that course very, very tight. And in the last forum, we talked about that if and when we have the next pandemic, we should be stronger. But one thing we all must try to do as we work out on what next is to actually reduce institutional rivalry. That is a formula that we still haven't been able to resolve. So I'm going to let you hear from the DG himself what he has to say about our meeting here today before I call on Nikes Dembi. So over to you.
The Honorable Anifa Kauia Bangirana, the Honorable Cicely Kariuki, Dr. Amit Thakur, dear colleagues and friends. The COVID-19 pandemic was a stark illustration of the need to bolster Africa's public health infrastructure. The private sector has a crucial role to play, from health financing to health products, from research and development to regulation and safety. Bolstering local manufacturing is critical. Only 1% of the continent's human vaccine needs are manufactured locally. WHO and partners have established the mRNA Technology Transfer Program, which is working with 15 countries in Africa and around the world to increase access to vaccines for COVID-19, along with tuberculosis, malaria, and others. A new mRNA research and development network will expand vaccine pipelines and accelerate product development and access to know-how. And WHO works with countries and industry to address substandard and falsified medical products. Private health providers are also important in Africa's journey towards universal health coverage, with half of health services in the continent delivered by private providers. At the center of our health systems is the health workforce, so supporting a decently paid, well-trained, and protected health workforce is vital. Women are the majority of this workforce, and they need our support and increased opportunity, particularly for leadership. Health must serve to reduce inequalities rather than widen them. WHO is committed to working with the private sector to realize the vision of a healthier, safer, and fairer Africa for all. I thank you. Asante sana.
Thank you so much, Dr. Tedros, for those words. Now it is my pleasure to invite our keynote address and a final speech for the opening ceremony. Please welcome Dr. Nikesh Dembi to the podium. Nikesh, the stage is yours.
I think maybe I don't need this presentation. It seems like all that's been said here. I'm very impressed by the powerful ladies on the podium. So I'm very, very intimidated here today. I'm going to do my best, I promise. First, there are some of those people in the world, when you start talking public health, you need to acknowledge them. And I'm coming from a school, you all know John Kengasong. So those are the heroes, the Ami Taka, all these ladies that you have seen today, Love, all those ones. I think it's quite impressive. I think I'm taking it back to the brain. We have talented Africans on this continent. But we need to start learning that something probably is happening that we're not getting it right. How do we get higher to unlock the diagnostics? How do we get the partners to work together? And then Amit mentioned something, rivalry around institutions. It's really an impediment for what we plan to do. If I ask in this room, how many know what we call Agenda 2063? Very few. I'm telling you, that is true. It's honest. I'm not going to do the survey now. But Amit, you're probably going to do the exercise. But you see Millennium Development Goal, we all know. What am I trying to say? We don't know our own instruments within the unions. We are 1.4 billions. We need to start valuing what we are in terms of market, in terms of innovations, and what we can do for this continent. That passion is in us, but we're not unlocking. We don't have the right key. Something is wrong. And while we're preaching, I think someone approached me yesterday during the dinner and said, well, we're creating movements, it's like a political party. No, a call for action, you have to be aggressive. You have to be provocative to move those lines. We're even very polite, the word we're using, new public health order. I was inclined to use decolonization of public health. They say, no, this is too rough. This is too rough. You don't go in a war by attacking. If people blood everywhere is not good. Dr. John Kengasong said, no, calm down. New public health order. It sounds a little bit soft, isn't it? Than saying decolonization of public health. It looks like a little bit fight there. Colonization wasn't a good experience anyways. So I've said thanks to those ladies, the powerful women on the podium. I think Dr. Ebere is somewhere there. She's also one of my heroes. I'm sure she's somewhere, if not. But again, thanks, Amit, for inviting us, inviting Africa CDC and the team behind you, Pooja, Daniela, Victor, Valentine, all those great people for this great meeting. So now I'm going to start. And then there are also a few people that, when they say I'm going to present here, they flew from Cape Town to here. I think Chantal, Nicole, and my sister, Naledi, those very good people. So that's already decolonization of public health. No, new public health order. So let me get started with my first slide, please. So the Africa's new public health order for Africa. The lessons learned from COVID-19. We've all experienced it. Our first test kit, our directors, we had to ship it from DHS somewhere and then subsequently in the suitcase. This is not the way we should be handling things as a continent. Next slide, please. So I think we talked about this. And I've already alluded to this. This slide alone is powerful. You can read at it different angles. The market size. You can look at innovation. So the future of the world is here. If you look at Africa, where we're heading to, projected population by 2050, 2.5 billions By the way, I think someone was generous this morning. He said we're only 1.2 billion. We're 1.4 billion. I think it's important that we put these figures into perspective. We need to trust ourselves. So on the right hand, again, very important. Urbanization, people are moving from rural areas to cities, the big cities. I think the ministers mentioned, Karaoke mentioned there. We have a fragmentation of generations. We need to think about that. People are moving, they don't want to stay longer in the rural areas. That's where I go when I really want to rest. That's in the rural area. Because those guys are left, they're now in the city, they're very busy there. So it means that looking at zoonosis, there's a likelihood that a guy closer in the rural area to a monkey or chimpanzee get this virus and land in Nairobi. And that's the beginning of a pandemic. Okay? Those are the implications. People are moving, getting out of those, and then going to the urban areas. I think that's a problem. The minister also mentioned one of our heroes there, community. That's the basis. If you don't get it right at the community level, forget about it. Community health workers, the addition from Zambia, we need to institutionalize it. It shouldn't be voluntary. Let institutionalize community health workers, empower them to be able to respond to pandemic. Next slide. So this is also a very powerful slide for all of you, wars. I think it's like we're in an industry of wars in Africa. It's here in Sudan, the next year is there, it's like blah, blah, blah. We're diverting our resources, and that's not quite a good use of limited resources. And then sometimes it's not really, we can't get to the bottom of it. I'm not saying I'm a peacemaker here, no, but anyways, this is not a good way. Because also that will inform my previous slide. People are moving again from those war zones to the closer countries, and then when they move with the virus. They can move with any virus. You can't stop the virus. If you want to do anything, stop human beings moving. As a virologist, I'm telling you, as you move with the virus. Okay, next slide. And this is a slide showing we have close to 5,000 airports in the world. See what is happening. As you see those people in Addis Ababa, Bole Airport, getting into a flight, this is how the virus also is moving. So the point here is that no one is safe until, that is the point there. Unless we shut down everything and then say, hey, everyone stay at home, that's the way the virus is going to be moving. So health security is a priority. You can stop all those businesses if the virus gets somewhere. I think we have learned from COVID. I'm not going to tell you any story about that. So, but that is the powerful message here. We are interconnected, globally interconnected. And it's a very strong message for all of us here. Interconnected. I've just flew from Addis. I don't know which virus I've survived from till I got here. I don't know where, because if I don't get any test or any symptom, I'm not going to go for testing. So next slide. So it means that we need to do cross-border surveillance. It's powerful. And thanks to the genomics surveillance, thanks again, South Africa here, thanks to South Africa for leading this effort. Omicron was isolated in this country. And we told to the rest of the world we have isolated Omicron. Isn't that powerful? Again, that's the public health order that we need to first own the science, innovation, to be able to drive any change across the globe. Next slide. So now let's look at the implication. That was my background. Let's look at the implication. We're not dealing only with COVID as we speak, so that you remember, there are about 70 to 800 outbreaks currently on the continent. They only tell you what are scary. I'm saying that because you guys probably don't know. When we say COVID and then the end of COVID, no, there are some other outbreaks. Those who are aware in the SADC region, cholera, isn't it? So that's a big problem. You know that because it's affecting more than 2, 3, 4 countries. But everywhere, those are happening. Marburg, Ebola, they are more frequent. Next, please, next click. And what are the cost implications? We're bleeding. And we don't want to bleed when you don't have resources. And when you go into war, you need to be prepared. If you bleed, that's the end of it. Remember, they're going to leave you because they're not going to stop looking at you. They're just going to keep on moving. So we're losing 800 billions per year. Those are the cost implications. So it means that we need to invest to be able to stop that bleeding. 800 billions per year due to emerging diseases, endemic diseases, NCDs, injuries, and mental health. That's a lot of money. That's a lot. Even if you split this, you can actually, divided by 55, is almost the budget of each African member state, AU member state country. It means that we bleed more than actually we feed ourselves. That's dangerous. Next slide. So we started looking at it and saying, what are the possible solutions? How do we stop that bleeding? Because that's an economic impact. That's why I liked Janet's introductory remark. We got all of targeted across development and health. Very interconnected as well. Next, click there. We started putting points together. We say, oh, public health institution. Well, when it starts and there's a pandemic, we all fall back on our public health institution. But how much are we giving to those institutions? Limited budget, limited resources. Basically, mainly they can't even pay some time of their personnel. So we said, that's the point to look at. The second, the workforce, we have all talked about it. I don't want to continue, but I'm going to unpack it subsequently. The regulatory mechanism, we talked about it, manufacturing, therapeutic, and say, why don't you call it something else? So that when you leave this room, you know that, well, we can call this something. It's the new public health order, not decolonization of of global health. Next slide. So next, please. So those are the 5 pillars. I'm not going to also go there because Ami talked about it. The ministers all mentioned those 5 pillars. It's good. I was happy on my seat where I was like, oh, good. The ministers, they know it. The president will also be aware. The first lady is going to be aware that we have a new public health order. That is good. That's what we want. Agenda 2063, we don't know, but at least new public health order is provocative. We know that. But when I was going through my slide this morning, I say, we're missing something here. And in fact, when Dr. Berry published one of her op-ed sometime back, I told her, no, there's a mix. I think it's like 3 months ago, I told her, we're missing the private sector here. So there should be 6 pillars, in my views. And that's why on that right hand, I put something that we need to include the private sector. It's important. We've all learned from COVID that the private sector, they play a significant role in addressing and then the COVID-19 pandemic. Next slide, please. So the public health institutions. We have Africa CDC now. WHO is 75 years old. We're only 7 years old. Completely gaps in generations. Back to the ministers here. So the new shift, the paradigm shift there. AMA, with the NEPA, EFCTA, those are institutions we need to strengthen. Be sure that we empower them to be able to respond to those public health emergencies. So on the right, you can see, we talked about research and innovation. We need to start doing that, okay? We might not expect that IP and tech transfer will come from somewhere. We need to start here. You look at examples in South Africa only, there are more than 100 clinical trials, phase 2, phase 3, that have ended nowhere in terms of moving those products into the industry, which is not good. Because you do research to end up with vaccines made in South Africa, and then you move to a product. So, but they end somewhere in the shelves because there's a disconnect between pharma and academia. That's our problems. So the workforce, we talked about it. The laboratory, we need to talk about it. Surveillance, emergency preparedness, disease prevention. We need to equip those institutions to be able to handle those key elements in our national public institute. I'm going to shock you and say, out of 55 AU member states, only 19 have a functional national public health institute. That's not good. We are vulnerable. It means that if pathogen X now strikes here, only 19 can be able to deploy what is required to respond to a pandemic. Pandemic, preparedness, prevention, and response, only 19 out of 55. We have a long way. That's why the new public health order is required here. Next slide, please. These are head of the Public Health Institute, and as Africa CDC, we tried a little bit to regionalize to localize our responses. We have 5 regional centers. Some of our colleagues couldn't make it to this meeting. They will have actually presented what exactly expected from a regional collaborating centers from the Africa CDC. But anyways, we're trying to bring what we have from Addis Ababa and the headquarters to the regions. Being sure that we address the priorities at the regional level. We listen to our member state to be able to implement the new public health orders. Next slide, please. Pillar number 2 is to strengthen health workforce. I fully agree. We all agree here. I think the Lancet Commission paper, someone really, but the 400 years, I'm not sorry for that. If I'm an editor, I'm going to push for the numbers there. 400 years to to close the gap, it needs some assumptions that are very solid. We can do it in less than 20 years if there's a commitment. So let's look at the next slide to a little bit be more specific there. So in terms of community health workers, for example, per 10,000 population. So you have the slide on the right? Field epidemiologist. The number trained, 1,000. We need 6,000. Is it not doable? Do we need 400 years to do this? My mathematics probably I'm not very good in math. I used to be, that's why I'm diverted to something else. But we don't need 400 years to close that gap for epidemiologists. And during the course of the pandemic, we established what we call the Partnerships for Africa Vaccine Manufacturing. If you want to produce, move from 1% to 60% by 2040, we need only to train 13,000 researchers. We don't need 400 years to do that. We don't need 400. Now I'm even inclined to write a response to that editor to tell him that is not accurate. The second, the frontline epidemiologists, we have trained 5,000, we need 25,000. But the point is that there's a gap. The point is that we need to mobilize resources to do this. We shouldn't stop training. We need to keep training, but the point is we need to retrain, upskilling, retention, reverse brain training. How do you attract those guys from Harvard University to South Africa and pay them the same salary to retain them here? It's not a matter of saying, well, we're passionate, we want a new public order. This guy is going to leave. They have a family of 10 kids or something. And a man there in Africa, there are about 200 people behind him. He has to take care of people in the family. So if you say, I'm paying you $10,000 per month, you move from Harvard University to Nairobi in one of those probably startup, guys, they're going to take it. But we are not just preaching and probably providing resources to be able to do that. So next slide, please. And we talked about leadership. I think one of the ministers mentioned it this morning. And Dr. Ebere is here. She's very well positioned and fast because she's part of this program to tell you that we thought of it as much. People are not equipped with leadership skills. They have very smart individuals, but no leadership skills. So this program, the Kofi Annan Global Health Leadership Program, was actually established to address that gap in terms of leadership. Because even responding to pandemic, you need to have strategic skills to be able to do that. Dr. John Kengerson used to tell us, a day in a pandemic is like a month. It's equal to a month. The time you're trying to figure out a leadership decision, gone. 1,000 people, I made point, the 70 million or whatever, people will die. You need to think strategically and then be actually a visionary leader. So those kind of trainings, they are twinning with experts and then leaders across the continent to build their skills. That's the Kofi Annan Fellowship Program. Next slide. And again, the workforce development is not only around that program. We're also planning to do an African epidemic service tailoring on what the US CDC is doing, the competency-based workforce development program, and then all this actually needs some adequate investment to be able to drive that. Next slide. So I'm going to touch a little bit on the vaccines as an example on how we can reverse this as part of the new public health order. So in April 2021, we called a meeting, which we're very impressed. 40,000 people attended online. I say 40,000. And that led to the establishment of the Partnership for Africa Vaccine Manufacturing. Next slide. So Dr. Tedros alluded to this. Only 1% of all the vaccines administered on this continent are produced in Africa. It's unacceptable. So we set our target here at the African Union to move that needle to 60% by 2040. It's ambitious, but how do we do that? How do we make it happen? Next, please. The next. So I think we also have the political will. We have the political will to support that, to make it happen, and that's President Kagame. And I can quote, because of this terrible pandemic, an opportunity has been created fundamentally to change the pharmaceutical production landscape on our continent. Now is the time to act decisively and quickly together as African and also globally. Next slide. So those are the enablers. If you want to really get it there, this will apply to diagnostics, to therapeutics as well. Those are the same enablers. So first, the market design and demand intelligence. I told you by 2050, we're going to be 2.5 billion on this continent. This is a good number in terms of really market size. So access to finance, we really want to convince the private sector and others, the big financial DFIs, to put in resources in this new business. It's important. If we invest into local manufacturing, both diagnostic, therapeutics, and vaccines, that's actually a good investment. Probably good. So technology and tech transfer is doable. We can do that. I think working on twinning with international partners and also locally, bridging that gap between academia and the industry. The regulatory strengthening, AMA, Audani part, being sure that we have harmonization, regulatory harmonization, convergence, we avoid fragmentations. The dossier being reviewed by 55 member states is not productive at all. R&D, again, putting the resources into R&D to be able to drive that. And then infrastructure development, free movement of goods. Vaccine can move from South Africa to DRC to Cameroon, and then we can move these goods across, given the fact that we have a population size estimate that is good, and as well as the volumes and demand here. Next slide. So to end on that initiative, when we launched PAVM, you can see this map. We have 30 projects now on the continent. I told you, there's a political will. Second, the funders want to align with the vision of the continent. There's a framework for action developed on how we would like the private sector, partners, and then our multilateral, the philanthropists to support us. Without a plan, it's difficult. Then they come in, they say, okay, well, we're going to support you on regulatory. We say, go to AMA. In fact, AMA is the one leading our regulatory strengthening pillar there. So that's the way a CISA agency work together to be able to drive this agenda. But the bottom line here, from virtually 4 projects to 30 projects, isn't a good sign. It means that we can achieve the 2040 agenda or target. Next slide. Again, Pillar 4. Our champion for Pillar 4, just to remind you, within the AU, we assign champions to very important topics. For vaccine manufacturing, His Excellency President Cyril Ramaphosa. For financing, domestic financing, is His Excellency President Kagame. For cholera, we have a champion. For any disease actually, or any topic of interest, we have our champions. I can say our champions for viral and epidemics is Prof. Muyembe, for example. So we are in fact Africans driving all those from passion to be able to do and move the public health agenda on the continent. Next slide. Also, the African leaders call for more investment in healthcare. It's mentioned, Amit mentioned it, and our honorable ministers mentioned as well. Next slide. But this is something, now, I'm not 100% happy. Because we make declarations, and the minister mentioned, we are very quick at signing this stuff. But I don't blame our head of state because they have technical people. You have an M&E framework, we should be able to tell them it's not doable. Let's be realistic. But the point is that there's a vision. So this is a communique, a declaration from our head of state. In addition, we pledge to set a target of allocating at least 15% of our annual budget to the improvement of the health sector. If you ask me how many, I'm going to give you the answer, because very few have done it. But the texts are very good. This is a very powerful declaration. But we're not doing it. That's the problem. But we need that public health, new public order is to really go back and find a way to push our head of state and government to go back to the drawing board and change some of these and implement some of these good declaration and initiative. Next slide. So I'm getting closer to the end of my presentation. The Musafaki as well raised it. We need to build finance mechanism that allows member state to respond efficiently and effectively to the needs of the continent. Next slide. So this slide is just to reemphasize that as part of the call for financial investment in the health system, we need a private sector. African-based philanthropists and communities in member states. Very important. So we've learned that from COVID. Next slide. And last is the respectful partnership. We're not, because there's a misinterpretation of this pillar. We're not saying we don't want collaboration, communication, cooperation, all the C's. What we're saying is that we have an agenda. We have identified our priorities. Please come and help us here. Rather than doing probably what we call helicopter research, for example. People come in, we say tuberculosis is our problem, malaria is our problem. And let's say emerging or emerging diseases, Ebola, Marburg, but you say, no, we don't, that's not very interesting. This, what is fancy for us is probably, I'm not saying that it's not very important, I'm giving a number, I'm giving a figure, is probably non-communicable. Non-communicable is also, what example can I give even there? Something that is not within our priorities. We say, no, please, these are lists of priorities for the continent, can you support us here? But we're not saying we shouldn't be co-creating that together. Let's co-create it together and be sure that we address the health need for the continent. So we're saying Africa originated and Africa defined priorities. We're aligned with the objective of the AU. We trust each partnerships, and then we coordinate together. We collaborate and ensure that we have mutual benefit. That's the most important there as we develop and we engage into partnerships. Next slide. I'm ending here to invite you to the conference on public health in Africa, which is going to be in Zambia in November. And if you look on the right hand, there's a journal, the Journal of Public Health in Africa. You see the conference and the journal. Those are powerful instruments of the new public health order. If you want to voice as an African, as partners, philanthropists, write your editorial there, and we're ready to publish it for you if it makes sense to drive the new public health agenda. So again, thank you, Dr. Amit and your team, and the very intimidating panelists, and all the participants for your attention.
Thank you. Thank you very much, our distinguished panel, for the opening ceremony. Now, Dr. Nikes, we as private sector in this conference, led by Africa Health Business, we want to commit to the Africa CDC that we shall support the implementation and achievement of a new public health order for Africa. And we have written this in a communique, our commitment to Africa CDC, that I now request our executive chairman, Dr. Amit Thaka, to step on that side and sign the communique, and Dr. Nikes to also sign acknowledging that private sector is committing to this. So if you could just go there, and I will ask our distinguished panel to also follow them and witness this historic signing of this communique. If all the photographers could go there, and we see private sector making a commitment that we are taking agency of the public health agenda of our continent, and private sector is on the table. Last night we were told if we're not on the table, we're probably on the menu. So this private sector here is not on the menu. We have brought our own chair to the table, Dr. Nikes. Once you sign, please come back to the stage for a photo opportunity and display our commitment. Sorry. Yeah. Or we can give them to sign later. Okay, all right. Yes, you can witness. Yeah. Yeah, no. Yes, yes, and then we'll have our NEPA, Janet. Sign the other side as well, here. Okay. All right. This has been witnessed by all the opening ceremony distinguished guests. Sorry. Yeah, here and here. So that one goes with, okay. And here we have, if you can follow me to the stage for the photograph, please. We have a communique saying that the private health sector is honored to announce its commitment to supporting Africa CDC in their new public health order. The COVID-19 pandemic has shown us there is a need for us to establish stronger surveillance and governance systems, predictable financing mechanisms, better structures to manage pandemics and public health challenges associated with the ongoing economic and political changes. Therefore, Africa CDC has launched a new public health order with a 5-point agenda: strengthening African institutions for public health, expanding manufacturing of vaccines, diagnostics, and therapeutics, investing in the public health workforce and leadership programs, increasing domestic investment in health, and action-oriented, respectful partnerships. We, the private health sector in Africa, represented at the 8th Africa Health Business Symposium, do hereby commit to support Africa CDC in implementing this new health order. We will actively engage and contribute our expertise, resources, and innovative solutions to support the implementation of the NPHO to address health challenges and strengthen our health systems. Isn't this moving from signing to action? Please come here and take a group photograph.